So moving to the next heart issues that could actually, disturb a baby. This is what we are calling what? Fetal tachycardia. So tachycardia, as a concept, tachycardia is like your heart is beating too fast. Do you understand? So fetal, we're saying this is occurring in a baby. All right. So the baby's heart is beating too fast. Now, for you to know if a baby's heart is beating too fast, you must actually know the normal heart rate of a baby. Do you understand? So it's where you know the normal heart rate, the range. You know that anything that is below this range is beating too slow. Anything that is above the range is beating too fast. Do you understand? So fetal tachycardia just have to do with the baby's heart is beating too fast. So the range of the heartbeat of a baby, I think, is 120 to 180. So anything above 180 beats per minute is high. So it can be temporary, it could be harmless. All right. So if it's just transient, you can just observe. But it's persistent, then you have to, initiate some treatments. All right. So types, it could be from the sinus, where it's getting so high by 180 to 200. Supraventricular is even higher, above 200. Atrial Flutter, then it could be ventricular tachycardias. Right. So these are the descriptions for you to know each type of tachycardia that I'm actually be setting in. Alright, so this is how an ultrasound to dictate it might look like. Alright, so an ultrasound to dictate it might look like. So causes. Issues could be from the mother, like the mother is having hyperthyroidism. So it's spreading to the baby. Could be fever, it could be infections. Could be that the mother is using some drugs that is side effects. Okay. Issues could be from the baby too. The baby is stressed, the baby is having low red blood cell count. Could be infections, congenital heart issues. Electrical abnormalities, that there's a malfunction in the heart's conduction system. Right. So this is how an ECG paper, all right, with a high fetal heartbeat will look like. So can you see that this is 180? So all the beats are actually what? Above 180. You see that? All right. Show you that the heartbeat is high. So diagnosis, you do echocardiography, M-mode Doppler, then additional tests like blood workup, just to know the cause, right? Treatments, if it is mild and transient, you observe. If it is persistent, they use antiarrhythmic drugs. You give it to the mother, it crosses the placenta, it reaches the baby. Okay, then keep monitoring the baby for possible fluid buildups. That's what fetal high drops. So that's just it for what fetal tachycardia.